Thank you, Madam Chair. I wanted to follow up a little bit on my colleague, Dr. Ruiz's questions about equity. Equity is a key tenet of the Biden administration's national COVID-19 strategy. And so I know that the Biden administration is taking great strides to expand distribution by setting up 20 high volume federal vaccination sites, which support 600 community vaccination centers, increase the number of community health centers and retail pharmacies, as we were discussing before, offering vaccinations in underserved communities. But I'd like to ask Dr. Walensky, maybe in a more open-ended way, can you explain how the administration determines first the location of these vaccination centers, and second, the number of doses to deliver to each jurisdiction? What are the basic factors that go into those determinations?
Thank you for that question, Congressman. The CDC works collaboratively with FEMA to find areas of high census and areas of high social vulnerability indexed as to best places to place these vaccination centers, as well as what volume they need, whether that area would support a 6,000 dose a day or a 3,000 dose a day vaccination site. As to how many doses and how that allocation happens, that happens at their operation level. And so, I can't speak exactly to how that occurs. We assist in the site selection.
Okay, well, I appreciate that. I would like to ask you, Dr. Walensky, too, a little bit about data. I'm very concerned about the quality of data. I think all sorts of federal agencies touch the data that comes in that's reported from states, and there's no standardization for how you report data from state to state, maybe even from hospital to hospital. So it makes it very hard for you and for us as policymakers to really understand what are the facts on the ground from which we can make policy decisions, and how you can respond to this pandemic and maybe future health crises like this. So I want to know, first of all, what guidance have you developed for state and local governments on like what data to report, whether you would standardize that, how are you dealing with the various silos in the federal government, and then also maybe you could touch on how the federal government protects the privacy of the data that's reported.
Thank you for that question. I think among the things that you're highlighting is that our data infrastructure was actually not well supported when this all started. And in fact, we are working hard on data modernization efforts so that we can ensure that data is coming there. That we have to provide independence to the state so that they can report as they are able, but then also some uniformity of data so that we can actually receive that data and report at a national level. So we are working closely with the states to unify the data coming in and to act as well as data modernization efforts in the context of this pandemic. I want to articulate that CDC does not receive individual line item data from individual persons. So we keep that, the privacy is held at the state, and we get data on aggregate unidentified.
Sure, but you'd agree that that if we don't standardize the reporting and we don't have an understanding about hospitalizations and pre-existing conditions for all the various people who are experiencing it, it makes it very hard for us to judge what's really going on the ground with accuracy. Is that right?
I think we have, a lot of individual states have had to develop their individual data systems, and we need to provide some independence for them to be able to do that, and some uniformity in reporting.
Yeah. I'm trying to help you with the uniformity side. We've actually introduced a bill called the Health Statistics Act in consultation with a lot of the statisticians in Washington who think this is really important. I'd urge you to ask about it. A lot of this can be implemented by the administration without Congress, but part of our effort is to provide financial support to local and state efforts to report these data to the extent they have to change their systems for reporting. So we would like to help you with this at the committee and hope that you'll take us up on that. And I guess finally, just to track our, maybe just to follow up on one more equity issue, since implementing the health center program, has the administration observed an increase in the rates of vaccination among Black and Hispanic Americans, and how does that look going forward?
Right. We know that the Black and Hispanic population had a larger life expectancy loss, a higher death rate. And so we are working actively to to make sure, we have 10% of resources, of vaccine distribution resources going to ensure health equity. We have worked on vaccine confidence consults. We're working with NGOs and community-based organizations to make sure that the message gets to trusted messengers. That's exactly the hard work that we have ahead.
My time's expired, but I had asked whether we'd seen the vaccinations go up among those populations.
Yeah, we are dedicating a whole lot of effort to that, so I would be surprised if that's not the case. That's fully engaged. We're fully engaged in that activity. That's what we need to do.
I thank the gentleman.